So actually take advantage from the introduction from Alessandra, Andrew, and Rita. So I can skip the first slides introducing the role of satellite cells in muscle regeneration, just to jump into a further issue, which is how is the activity of satellite cells coordinated by the cells that populate the muscle stem cell niche. So upon whatever type of muscle perturbation, and I take here the muscle injury, the acute muscle injury that we use in our labs by injecting cardiotoxin or notoxin, what we typically see is a response from coordinated waves of different cell types. So the first cells that immediately come into the muscle are cells that belong to the inflammatory infiltrate. And just right after, these cells, called fibroadipogenic progenitors, start to expand. Those are interstitial cells, I would say mesenchymal cells, that are composed by different type of subpopulations, probably reflecting different cell states. And what they do is to start to exchange signals with satellite cells. Essentially, there is a network of signals that are supposed to coordinate the activation of the satellite cells within a certain time frame, their proliferation, their differentiation, and the return to quiescent of a certain portion of the pool of quiescent cells. So this can have a different outcome. If we talk about an acute injury, normally the muscle are endowed with a very strong repair potential. But in the case of chronic injuries, which is typically what happens in muscular dystrophies or other muscular disease, what happens that these cells start to accumulate and mediate, and they become the cellular effectors of the two most detrimental events in this disease, which is fibrosis and adipogenesis. So you just want to emphasize how FAPs are central to exchange signals with satellite cells, with the cells of the immune compartment, but also their ability to differentiate in different type of cells that can mediate these adverse outcomes. So when things go fine, the satellite cell receives some signals from fibroadipogenic progenitors, and this is typically supportive for myogenesis. But in the case of chronic disease, what happens is that the fibroadipogenic progenitors start to cheat on the system and convert into mediators of fibrosis that is typically seen in muscular dystrophy, including Duchenne muscular dystrophy. So we have a situation where they can behave as a very good, they can, I think something. Oh, can you hear? Perfect, okay. So they can mediate a regenerative response, but also you can see here what happens when they start to mediate these detrimental outcomes. This is, for instance, the typical histological pattern of Duchenne muscular dystrophy, whereby all contractile units are replaced by fibrosis and fat. So what are the soluble mediators by which fibroadipogenic progenitors can instruct the activity of muscle stem cells? We started with a very, very simplified approach. So essentially, all these populations can be FAC sorted by means of surface cell markers. And what we started to, how we approached this issue was to use the transwall culture. Transwall culture is a perfect way to identify factors that establish the exchange, the functional actual interactions between fibroadipogenic progenitors, which are placed on this surface, and skeletal muscle cells. And if you do these experiments, you see that upon co-culture, transwall co-culture with fibroadipogenic progenitors, muscle satellite cells differentiate much better. This can reflect their ability to expand them, but also their ability to promote their fusion. However, when we use this sphingomyelinase inhibitor, GW4869, which typically block the release of extracellular vesicles, or if you will, exosomes, there is a controversy, so I will refer to EVs, extracellular vesicles. You see that these functional interactions are blocked, suggesting that probably extracellular vesicles are important mediators in fibrodipogenic progenitors mediated activation and differentiation of muscle stem cells. So we started to verify this hypothesis, and we used the supernatant of this fibrodipogenic progenitors culture, whereby we could identify we used three kits. I'm just showing one of them, but invariably we could purify the extracellular vesicles that obey to all the criteria for their definition as exosomes. Still, I will call them extracellular vesicles because it has been recommended by a reviewer. So you can see, it could be one of you guys. So you can see in the electron microscopy this picture that clearly spots one of these vesicles in the close proximity of satellite cells. So it's highly possible that these vesicles mediate important information between muscle satellite cells and neighborhood cells. And this is the formal evidence that when you inject, when you transfect CD63, which is a typical marker of extracellular vesicles in fibrodipogenic progenitors, it's clearly visualized by 63, so that means that it's incorporated into extracellular vesicles, and upon the transwall culture is efficiently transferred in the satellite cells. And as you can see that this process, now we're using an even better dye, it's blocked by, almost completely blocked by GW4869. You can see some residual sign, but really minimal. So we started to get very interested in how these fibrodipogenic progenitors can release extracellular vesicles that can somehow educate the activity of satellite cells. And the first thing we wanted to go was to in vivo model, where you can appreciate the massive accumulation in the interstitial space of regenerating muscles of these cells, always in close proximity of SCA1, which is a marker of fibrodipogenic progenitors, and regenerating fibers, which are marked by embryonal myosin heavy chain. So this was the first evidence that there is a release of these extracellular vesicles once the muscles are induced to regenerate. And you can see that in a regenerative stage of MDX, the mouse model of Duchenne muscular dystrophy, there is certain accumulation resembling the regeneration, but the later stage is lost. So we started to chase this evidence under the assumption that once the extracellular vesicles are not released, somehow the compensatory regeneration that typically occurs in dystrophic muscles starts to faint. And this is kind of interesting because when we use a drug that Alessandra anticipated, HDAC inhibitors, that typically promote or at least promote compensatory regeneration, reduce fibrosis and fat accumulation, they work very well in the context of young MDX mice, which means at the regenerative stage. But at later stage, they cannot increase the cross-sectional area, they cannot promote the regeneration, and they fail to prevent fibrosis and fatty degeneration. So this is highly relevant because, first of all, this was a driving observation that allowed us to stratify the patients. Because of this, in the clinical trial that we had done with the Givinostat in collaboration with Italfarmaco, we selected only patients, ambulant patients, which supposedly are highly regenerating. But it's a problem not to use these compounds at late stage of disease progression. And HDAC inhibitors proved to be as efficient in human as we observed in the mouse model of Duchenne muscular dystrophy. You see that patients showed an increased number of regenerating areas and decrease in fibrosis, fatty replacement, and fibrosis. So this was a very important evidence that at histological level, HDAC inhibitors can prevent the progression of Duchenne muscular dystrophy at patients within the early stage of the disease. So, confirming the ability of HDAC inhibitors to promote regeneration, you see that normally they can further promote the regeneration also in the acute model of muscle regeneration. So, wild-type mice are induced to regenerate, and TSA further promotes the activation of satellite cells and formation of fibers. And that's what happens also in young, but not in old mice. So at this point, we started to challenge the previous system with the TSA. And here again, if you remember the picture I showed you before, in the context of young, highly regenerating skeletal muscles, HDAC inhibitors could further promote or expand the number of extracellular vesicles, but they failed to do so in the context of old, late-stage MDX mice. So we started to further investigate this issue by using a very simple system. So we treated the MDX mice with trichostatin A, HDAC inhibitor. We isolated FAPs that have been exposed to HDAC inhibitors in vivo. And we co-culture with satellite cells that come from the same mice that were not exposed to the HDAC inhibitors. So we co-culture these cells, and as you can see, forget about it. It's not a co-culture. We isolated the extracellular vesicles from the supernatant of the FAPs, and we transferred to the satellite cells. And as you can see, upon stimulation with TSA, there was much better effect of extracellular vesicles on skeletal muscle stem cells, indicating that HDAC inhibitors somehow promote the formation of promyogenic extracellular vesicles. The same information can be seen when we do exactly the same experiment, but rather than using FAC-sorted muscle stem cells, use the myofibers, single myofibers, where you can spot the satellite cells as a PAC7 single positive, MyoD single positive, and double positive. I'll make that short just to show that with the TSA, you see an expansion of PAC7 MyoD positive satellite cells, which means that there is an expansion of those cells that we used to call activated. And the presence of the sphingomyelinase inhibitor could clearly reduce this activity. So at this point, we started to get really interested into how these extracellular vesicles that stimulate the activity or the activation of satellite cells, what do they contain? Because of course, we know that there is a high content of proteins and ribonucleic acids. And we're very interested in understanding whether the pattern of microRNA, which are supposed to be important effectors of the activity of extracellular vesicles, was changing depending on whether the fibrodipogenic progenitors have been exposed to HDAC inhibitors. As you can see, upon exposure to HDAC inhibitors, there is a huge number. Those are the top 14 microRNA that are upregulated in the extracellular vesicles. So essentially, there is a pharmacological lifting of extracellular vesicles, whereby there is an accumulation of a very interesting pattern of microRNA. And if you look at this, all the putative targets of these selected 14 microRNA are implicated in processes that are typically regulating muscle stem cell activity, including Notch, TGF-beta, and IL-6. So, and this is the confirmation actually that all of them that we have seen induced in the microarray are actually also induced by validation by PCR. So this is really fitting with a model whereby the upregulation of different microRNA that could target different network could provide a sort of combinatorial activity by which these extracellular vesicles that are being lifted by HDAC inhibitors can exert their beneficial effect. We tested this. What we have done is to abrogate the myogenesis of microRNA by knocking down DROSHA. And as you can see, once the biogenesis of microRNA is inhibited, these extracellular vesicles fail to promote the activation of satellite cells and the formation of myotubes. This is kind of interesting, the microRNA, because when we survey a number of histological, a number of patients, we could see a clear relationship, inverse relationship, between the abundance of MIR206, which was, by the way, the top microRNA upregulated in these extracellular vesicles. You see it start to accumulate in the muscle of highly regenerating, and then a little bit less at later stage of the disease. At 9 years, there is very, very little accumulation, suggesting, again, fitting with the idea and with the evidence that extracellular vesicles containing this microRNA fail to accumulate at late stage of disease progression. And this correlates with increased fibrosis and decreased regeneration. And when we use the HDAC inhibitors in the mouse model of Duchenne muscular dystrophy, we could see a clear increase of the 206 signal in the interstitium of skeletal muscles, very often in coincidence with the presence of fibroadipogenic progenitors. So we wonder whether at least we started to dissect the role of different MIR, and MIR microRNA at 206 was clearly the first target. So we used the same assays as before, and we observed that an antagomer of 206, when transfected in fibroadipogenic progenitors, could completely abrogate their ability to promote to release extracellular vesicles that promote satellite cell activation. So these microRNA are really important, and in the case of 206, it's critical to promote the activation of satellite cells. So further on, we validated this in vitro for one reason. We had done all the experiments by isolating fibroadipogenic progenitors from MDX mice that were exposed to HDAC inhibitors. That means that a lot of stuff can happen because we're working on a system where there are several cell types. In this case, we isolated first the fibroadipogenic progenitors. We put them in culture and we exposed them to HDAC inhibitors. And you can see that we can recapitulate exactly the same effect. Production of and release of extracellular vesicles which are enriched with the same pattern of microRNA that we have observed when we were isolating the fibroadipogenic progenitors after the treatment with TSA in vivo. And again, you can see that the in vitro treatment was equivalent to in vivo treatment in terms of formation of extracellular vesicles that promote the activity of HDAC inhibitors. And using this system, we could collect the supernatant and quantify whether, actually I would have never done this experiment if I wasn't asked by a reviewer, but that fibroadipogenic, because the issue is whether they're proliferating more and then producing more extracellular vesicles, or the same number can produce more extracellular. So the second was true. You see that the same number actually can produce more extracellular vesicles. So somehow, HDAC inhibitors promote the formation and the release of this extracellular vesicle. And this is very interesting because we're talking about MIR that can be induced in several cell types within the myogenic compartment. So the in vitro experiment allowed us to test the cell specificity. So we took the supernatant of 3 cell types that can be target of HDAC inhibitors within the context of muscle regeneration and muscular dystrophy. And we tested each of them like muscle stem cells, the myotubes that derive from muscle stem cells, and the fibroadipogenic progenitors for the release of extracellular vesicles that are rich with miR-206. And that happens only in fibroadipogenic progenitors, despite the fact that HDAC inhibitors could promote the transcription. You have to go here, the black box, can promote the transcription of 206 invariably in all the cell type. So it's not a matter of transcription activation, but rather the packaging of extracellular vesicles where HDAC inhibitors somehow stick into it more and more microRNA. So last experiment was to test this system in vivo. So what we've done, we purified again the extracellular vesicles from FAPs that are being exposed to HDAC inhibitors. And what we have done is to compare their therapeutic potential side by side with HDAC inhibitors like TSA. So MDX mice were either treated with TSA or injected, intramuscular injection, of course, so we could control only one type of muscle with the extracellular vesicles released by fibroadipogenic progenitors treated by HDAC inhibitors. And what we found, it was a striking equivalence in terms of therapeutic efficacy. So essentially, you could see that upon injection of extracellular vesicles, we could stimulate muscle regeneration, reduce fibrosis, and reduce the inflammation of dystrophic muscles as well as systemic exposure to TSA does. And what is interesting is that when we isolated the extracellular vesicles after the transfection of antagomere against 2 of these microRNA, either 206 or 145, we see that most of these beneficial effects were abrogated. And it was quite interesting, again, pointing to the combinatorial activity of this microRNA, that, for instance, when you use the antagomere against the 206, we could see a loss of the effect on proliferation, fibrosis, but not on inflammation. Instead, when we use the antagomere against 145, we could see the effect on the 3 parameters, still suggesting that all of these microRNA contribute by target individual pathways to global activity. So I can stop here. Conclusions here are that we identified a way by which fibroadipogenic progenitors support the activity of muscle stem cells through the release of discrete particles called extracellular vesicles or exosomes. They contain microRNA, also proteins, and we found that these microRNA are massively, a discrete group of microRNA are induced by HDAC inhibitors. This is a therapeutic induction because they seem to be essential for the beneficial effect of these extracellular vesicles. So we believe that the pharmacological manipulation of extracellular vesicles from specific cell types can be used to increase the specificity of these interventions. And I would say eventually target a specific group of muscles. I think this is extremely important. Rita was referring to this prior to my talk. I mean, nowadays there are a lot of dystrophic patients that are restricted, they're confined in a wheelchair. And their therapeutic goal, the most realistic therapeutic goal there is to keep them able to use the few muscles left. Those guys want to keep on eating, being independent, grabbing a glass of water, and work with the computer. So the idea of having extracellular vesicles, inject them in discrete group of muscles to keep them functional, I think is a realistic and very exciting therapeutic perspective. Thank you for your attention. Oh, the people. I haven't done any of these experiments, so I'm commenting on the activity of the people in my lab. So they deserve the full credit for what I've said, and of course the funding agencies and the people working on the clinical trial. Thank you very much.
Thank you, Lorenzo. Questions? Maybe I can start. So you talk about the exosomes like present in the muscles. Have you profiled the exosomes in also the circulation? Do you see different profiles in this context?
The exosome in the we didn't profile the exosome in the circulation, but we have seen a much higher abundance of exosomes at the paracrine level, at the muscle level. I mean, the circulating exosomes or extracellular vesicles is still a matter of controversy, so I'm not even sure they can circulate and mediate, communication at distance between organs and tissues.
Hello. I was just curious because in what you've proposed as the next stage for the clinical evaluation is the use of the exosomes in order to impact an outcome. Have you also considered the approaches that might engage using the mRNA to cause that increase within the body?
So the upregulation of microRNA has been shown to be effective in different type of muscle disease. For instance, a transgenic mice for 206 have been shown to reduce the pathology in a mouse model of ALS and MDX. Those are studies from Eric Olson's lab. But we're still talking about the activity of one microRNA. So the power of extracellular vesicles is that you can cluster different type of microRNA. You can lift, and I think in the future technologies may also make available the possibility to introduce microRNA a la carte in extracellular vesicles to have more and more effective. So I believe that also in terms of release and safety, probably extracellular vesicles are better than a single upregulation of one microRNA.
Can you comment on, so assuming delivery is all taken care of for exosomes versus the cell transplant or anything, what about the persistence of the effect? I mean,
Right now, all I can say is that it would eventually require multiple injections.
I'm sorry, what?
Right now, all I can imagine is that it will require multiple injections. We see that after one injection, at least in the mouse model of muscular dystrophy, we don't see extracellular vesicles from day 10, 12 post-injection. So they're either cleared or incorporated in the cells, but you will eventually need to re-inject the muscle. So either the technology comes up with something that persists longer, or the requirement will be to inject multiple times single muscles.
Other questions?
Andrew.
Just repeat it for me. So can you find extracellular vesicles in plasma, and could you therefore take it from a parent and give it to the child?
So Andrew is asking whether we can find extracellular vesicles in the plasma, collect them and use them for therapeutic purposes. As I said, there is one bias essentially that refrains me from using this approach. That when we use the extracellular vesicles isolated from specific cell type in the muscle, we are collecting a very discrete population of extracellular vesicles. In the plasma, probably you have extracellular vesicles if they circulate, because I'm not sure about that, that may derive from multiple cell types. So you have a mix of, and I'm pretty skeptical about the efficacy this way.
One more question? Yes? Yeah.
Order.
What the heck, might as well ask another question and let people go to lunch. As we age, muscle dropout occurs. Is there any potential role for exosomal transport to be diminished in that? And the work of Stanford, the Sanford group recently saying that at least in old coots like me, running a little bit helps to mobilize the muscle stem cell compartment. And also, I'm wondering, do you have an answer to any of this or any speculation on that?
We're clearly interested in your addressing your question, also for personal reason. So we're trying to profile, comparing the abundance and the content of extracellular vesicles in young versus older. I have no data right now to share, but overall, it seems that in the aged patients, I don't like to call ourselves old, but in aged patients, the extracellular vesicles are less abundant and different in terms of content. The question is whether they're losing activity or they're acquiring detrimental activity. So we're very interested in understanding whether we're not only losing extracellular vesicles, but we're also starting to get enriched in sort of enemies. So that would be the case of, once again, trying to pharmacologically lift and neutralize the pro-aging effect of extracellular vesicles in aging organisms.
All right. Thank you, Lorenzo, and let's thank all the speakers on the panel.